Welcome, everyone. My name is Joseph Horn. We are here with Global Entrepreneurship Week, Fort Worth, 2021. We have a wonderful program today. It has to involve Power Fort Worth. And I have with me three wonderful individuals who are leaders within the community. First, I have Dr. Deborah Atkinson, who is a psychiatrist who is retired from private practice and giving back to the community as a professor and physician coach at the TCU UNTHSC School of Medicine. She is part of the Who's Who here in Fort Worth and has appeared in many TV shows on mental health subjects. Hello, Deborah, how are you doing today?
I'm good. Glad to be here.
And we also have with us Desiree Partain, a former paramedic who, through her passion and leadership, is now the transformation manager at MedStar. MedStar is responsible for the ambulance or EMS services here in the Fort Worth area. While other areas have encountered substantial losses in ambulance staff and shortages and so forth, MedStar has not. They are doing the right things. They're doing things right. Also, hello, Desiree, how are you doing today?
Hi, thanks for having me. Doing good.
Great, thank you. And we also have with us William Billy Mitchell, who has just retired from 30 years of public service with the Fort Worth Police Department. Billy was head of the peer support group with the Fort Worth Police and led the department's training in critical incident stress management. Hello, Billy, how are you doing today?
Oh, it's good to be here.
Great, it's great, glad to have you all. Why are we here today? Why does it matter? Well, friends, a study using from CDC data reports that 1 in 5 Americans today are prescribed mental health medication. That is a large number. And then when we look at before the pandemic, 15.8% of Americans were on medication. This is why it matters. It impacts productivity. It impacts how well we interact with each other socially. It impacts all sorts of things in our society. Mental health is important. We think about exercising our bodies, protecting our muscles there, but we have to do the same with our minds. Our mind is a muscle. So as a brief introduction to Empower Fort Worth, I'm going to talk from the legal side. Here we have these other individuals, my friends on this panel. They represent the medical community, first responder, and police. How did I, as part of the legal community, get involved? Well, I've had clients, family, and friends who have had mental health challenges. In fact, we all have them at one time or another in our lives. Many are situational. We face financial pressures, health challenges, lose a loved one, or our job. In fact, we all have them one point in time or another. But mental challenges can also be organic or hereditary. As a former disability coordinator of the U.S. House of Representatives, I was involved in formulating many of the responses to mental health challenges and safety threats. 2, I also became to see here in Texas that I was going to the Bar magazine, how many younger lawyers are dying and leaving the practice of law at an early age. And we knew that something was going wrong. According to the American Addiction Centers, more than 45% of Americans, lawyers, suffer some depression at some point during their legal career. Of those individuals, nearly 12% of them reported suicidal thoughts at least once. A recent study of a law school found that 40% of the law students were clinically depressed. 9% of lawyers struggle with prescription of drug abuse. So in a report by the ABA Commission of the Lawyers Assistance Program, the Betty Ford Foundation found that nearly 21% of lawyers and those in the legal related professions also suffer, I would say, problem drinkers. I guess it was drinking, alcohol abuse. So this is the backdrop of how I got involved. And as a member of the local bar association, I was asked to form a wellness committee. And this was to help attorneys in our community figure out how to address these issues more positively, given the high incidence of burnout, substance abuse, and suicide that was occurring. The committee was co-chaired by with now retired Chief Justice Terry Livingston and Justice Sue Walker. We had one of the best turnouts in our group. However, the challenge was a lot of the people who should have been there were not showing up. And why? Because of the stigma. There is a stigma associated with seeking mental health. Lawyers are viewed as in control. We're expected to be confident, be the gladiators in a courtroom, aggressive, and even heartless. And many times the stakes are high. When you go to court, there is a winner and there is a loser. Nobody wants to be the loser. And so these are issues that face us. And the long hours, sometimes all night, dealing with issues that are important not only to an individual's family who's struggling, but also to those that have to do with the rights of our country. These are important issues. And the fight for justice and the underdog, it is something that's sometimes unpopular, but we do it because it's the right thing to do. Looking around, we see a lot of our other societal helpers are also struggling. We find that many of the issues that we were dealing with, our fellow helpers were dealing with. People in the physician field, people or the medical field, the first responders. We found that all of them were suffering the same issues that is hard for the helpers to seek help because again, we're expected to be strong. We're not expected to be weak. Seeking help is sometimes viewed as weakness. So we found that stigma is a big challenge and our fields are tough. So people again, expect us to be tough. So how do we seek help in this environment? That is why we came together to combat stigma, support each other and support collaboration in a way that helps impart skills and encourage each other to be able to seek help, not within just our community, but hopefully for the whole, eventually the Fort Worth community. So that's why we came together, because we believe these benefits of learning how to empower each other, self-empowerment and building mental resilience will make us a stronger community, kinder community, smarter community, and a more productive community. So now, this is where we started from. That's my background as an attorney. I would like to now turn it over to Deborah. Deborah, thank you so much. Here we go. We'd love to hear from your perspective from the physician field.
I will certainly be glad to talk about that because it is a passion of mine to try to help physicians and everyone in healthcare be more well themselves and be able to walk the walk of what they talk about. I've graduated from medical school 35 years ago. I have been in the Fort Worth community since 1992. I've actually practiced child and adolescent psychiatry and general psychiatry post-residency and fellowship for 30 years now. And as you mentioned, I'm semi-retired in a way from private practice. I still do some clinical practice, but not the amount of practice I had been doing when I ran a large practice in Fort Worth, so that I could go to the medical school and work with students on a new physician development coaching initiative. Our school at TCU really focuses on what we call the empathetic scholar. And what I'm learning in the last 3 years from being a coach for these students is that they too begin to fall into some of the same traps all of us fall into who are helpers. So a big emphasis of the coaching is to help with self-awareness, mindfulness, their empathy, and the self-care. So in terms of looking at this more broadly, this is how I got involved in Power Fort Worth. I met Joseph and we got into a discussion, and I have been frustrated for a long time about everyone who are helpers. I've worked a lot in my psychiatric practice with physicians. I've worked with EMTs and paramedics. I've worked with police officers. I've worked with nurses. I've worked with many helpers and lawyers. Oh my goodness. I think lawyers, there were some day when there would be 4 lawyers coming to see me, and I was just glad they weren't back to back so they didn't see each other, right? Because you're absolutely right. And this is what I have concluded over the years. Everyone who has a helping mentality, we all feel that we must be strong. And part of being strong is denying sometimes our own human reaction. And I think the hardest thing to learn, and it's what I'm working with the medical students on, I'm actually working and coaching some other physicians in the community, as well as one of those young lawyers that Joseph referenced. And what I'm finding in common with all of them is there's this sense of, because I have to be strong and I have to be in control, in that moment, you do have to focus on the problem. But what they have to learn to do is, how do I disengage and step back from that, knowing I have done what I can do? Did I learn something from it? Look at how it impacted me emotionally in the moment. And how do I take that and use that knowledge and information as I go further on, without it completely really getting into some of these negative self-talk and that we get into when we don't feel we have done everything we could possibly have done, or we just weren't good enough, or we just weren't strong enough. Because the reality of our work, all of us, Joseph, you talked about winners and losers. That's true in a courtroom. When you are on a medical floor taking care of someone and they die, you feel like a big loser. When you show up with that ambulance and you can't resuscitate somebody, you feel like a big loser. And Billy, I can't imagine all the things y'all have walked into where the police officers walked away feeling like big losers, even if they were not the people that instigated what happened in front of them. So that same dynamic occurs with all of us. And talking about the mental health pandemic, I want to just spend a moment to talk about the mental health pandemic and the pandemic. Folks, I hate to be the bearer of bad news, but we were in a mental health pandemic before COVID-19 hit. We were seeing increasing suicide rates all across the country. Our children and adolescents and teens, suicide was the #2 cause of death in the United States in that age group. And there's now some discussion of, is it actually, it's risen so much in the last year. We don't know if it's still #2. The only thing that took out our college students and our teens before suicide was accidents. And so it's been a very high cause of death for a long time, and it's rising. Unfortunately, in those of us who provide the care, it's been rising astronomically. In 2018, the statistics on physician suicide in the United States is that, unfortunately, physicians are striving, hardworking people. We want to be #1, right? Well, one list that we got to be #1 on for the highest amount in a profession that we should not have wanted to be on was suicides. 28 to 40 physicians per 100,000 in this country commit suicide per year, leading to a total of at least one doctor dies every day. So it's an epidemic among us. And do you think we don't seek help? I can't tell you how many physicians I've had sitting in my office who, after I talked to them for 30 minutes, I was able to get the underlying information about their suicidal plan and how they had it structured so it wouldn't look like a suicide. And they were even planning when they would do it. If they were on call for their call group around the holidays, they wanted to make sure to meet that obligation. And you will read case studies on doctors who commit suicide, and this is very common. They'll meet their obligation, then they'll go quietly somewhere and commit suicide. It's beyond tragic. I suspect there is a similar parallel to other people. I see Desiree nodding her head, and Joseph and Billy. So that's been there for a long time. Here's the thing. The COVID-19 pandemic has put it into overdrive. And what I'm starting to see and hear is physicians in their 50s who have a lot to give are saying, I think financially I can walk away now. I hear nurses saying, I have done my time. And when I'm in here taking care of people who have not followed medical advice, I don't know that I want to keep doing this right now. There's a lot of burnout. There's a lot of empathy depletion. There is a lot of moral injury. And these are the things that really impact all of us who are helpers. So what can we do to help with Empower Fort Worth? One of the things I think we're really striving for, our motto is to help build mental armor, ways to save a community, build mental armor. When we talk about that, here's the thing. Anybody who does our type of work is not weak. We are all strong. But there is this stigma that if you reach out for help, you're somehow weak. We want to try to work at taking that away. And I think there's a lot of ways we can do this so that people don't have to get to the point where they need a mental health service and they need to be on medications. I think there's a lot of modalities. I have become a certified coach. It's an initiative we're doing at the medical school. I'm doing that with other professionals now privately outside the medical school as well. And I think that when we help people with a wellness journey, and help teach them some basic skills and tools they can use. If there's an intervention soon enough, it's not going to get to this point. And how do we make that intervention soon enough? We help get rid of the notion that reaching out to learn some things and being in a community that helps you with that, we reach away from that. I'm going to spend just a moment sharing a screen to talk about a coaching wellness journey. And okay, I believe I've got that up there. This is a coaching roadmap. This is from my website, accocoachingrx.com, but the coaching roadmap is what I really focus on. This is something that I think could be so helpful in coaching, but I also think this is exactly some of the process we're trying to do with Empower Fort Worth. We want to help individuals figure out ways they can achieve wellness. And this isn't a step 1, 2, 3. These are things that happen simultaneously, that you really work on wellness and balance in your life. You start thinking about areas you want to grow in. I found that for many people, what's been one of the most enjoyable thing I've done with coaching some ER doctors during the pandemic is finding out that some of those who wanted to quit were actually able to take a step back, and even in the middle of the pandemic, get back in touch with their purpose as to why they were doing this and what were areas they needed to grow in a little bit to help strengthen them as they move forward. Take this information, dare to dream the path you want to take, get back in touch with your joy and your purpose. All of us who went into this line of work did it for that reason. You figure out your roadmap and how you move forward, and you do this to realize your best self. And so this type of roadmap, I'm going to stop sharing screen now. This is sort of just some very basic principles we do in coaching, but I see this as something we could incorporate and use with and give information to people, do workshops. I believe we could really help disseminate this and normalize. That's the one word I want to say. We want to normalize, encourage, and reward people for learning how to take care of themselves and do this. I'm going to part with a comment I heard from a young CEO of a healthcare industry that is here in North Texas now. We were having a conversation just this week, and what he said to me was, I would so rather have an employee that comes in here that works 40 hours a week, takes care of themselves, shows their joy and purpose in their work, and they're still with me 5 years from now, instead of somebody who feels they have to suck it up and work 60 to 80 hours a week and never talk to anybody about what's going on and don't take care of themselves, and they're no longer with me 2 years from now. He said, that's what I would rather see. So I think if we can start to normalize this as a strength, I really think that this is a really powerful movement amongst all of us, and I think it can change a city. So Joseph, I think at this point, you're wanting me to turn this over to Desiree. Is that correct?
That's fine. If I could just interject and make a few little points to follow up when I heard from you, Deborah. You mentioned about kids. Before the pandemic, 1 out of 8 high school students in Texas attempted suicide. Huge number. I've heard from Cook's children that numbers of attempted suicide among children have skyrocketed during the pandemic. You also mentioned about burnout within the healthcare field. I have read articles saying that in some hospitals in other parts of the country, 30 to 40% of the staff are quitting. That's a huge number, and that impacts the safety of everyone in that community. I've also heard some studies say that physicians have the highest suicide rate of all. How well those numbers are reported, that's interesting, because in the Texas Lawyers Assistance Program, they did a presentation about suicide and mental health a couple of years ago. And I remember a bankruptcy attorney colleague of mine went up to one of the presenters afterwards and said, hey, great program, so forth. Do you know what the statistics are on bankruptcy attorneys? Because the presenter was talking about different fields and said, oh, well, bankruptcy folks, they seem to have no problems because we don't have any statistics. Anyone there has ever committed suicide. And his response was, gee, really? Because we've had 3 bankruptcy attorneys kill themselves over the past 2 years in the Fort Worth area. So I kind of wonder how well these numbers are being reported. I don't know if they are. I know it's a stigma and embarrassment to family members to have that information come out. So it is interesting. But anyway, I have said all of that. I'm sorry, now to bring Desiree in. Desiree, look forward to hearing from your perspective and all that you do in saving lives and your team there. Thank you very much too.
So Desiree, you're like me, you're on mute.
I'm on mute. Thank you. Thank you so much for having me. And so I always like to start with, I truly believe that mental health and wellness, that there is this strong correlation with mental health, wellness in relation to vulnerability. So I always believe it's always good to be a little bit vulnerable. So why am I here? For me, is I have been in the emergency medical services field for close to 20 years now. Yes, I started when I was 5 years old. And so I've seen a lot, I've done a lot. And to be very honest, I've been to burnout. I've been through burnout. I've not made great personal and professional decisions. I've had compassion fatigue. And I have personally been affected by suicide a few years ago. And that whole experience really opened my eyes to a lot of things as it relates to mental health in our community, to suicide awareness and prevention in our community, and not just in our community, but for our first responder organizations and community as well. And really the gaps that are associated with mental health, wellness, suicide prevention. So that is really my why for being here and being with this group. So I do want to share my screen here so y'all can see it. I think that a huge component of mental health, especially in the first responder industry, has to do with expectations versus reality. And hear me out for just a minute. So when I signed up to be a paramedic, when I went through school, and I had this expectation that I was going to get on that ambulance and drive lights and sirens, and I would take people who were, at death's doorstep, who were critically sick, and I would do all these life-saving interventions, and then I would take them to the hospital alive. And I would see all these crazy things, and I would just be around pleasant, happy people all the time. And what I realized is my expectations early on in this career were a little bit different than when I actually stepped on to that ambulance, and the more years and experience I got working just out here in Texas and out where I'm from in California. And I think I had a personal expectation of what this industry, what it would be like to be a first responder, to be a paramedic. I also believe that, and Deborah and Joseph have kind of touched on this, is that there is a society expectation about our first responders. And I think this meme beautifully sums it up, right? So there's my expectation, there's my mom's expectation, my boss's expectation, and then there's society's expectation of, this hero mentality, this hero concept, and you all, see things and do things, which is, in a sense, that it is some of the things that we see. But I will tell you in complete transparency, especially when it comes to the EMTs and paramedics that work on the ambulance, 90% of what we see is what we call lower acuity type of issues. Here's why: because we have taught society to call 911. And so when you call and you call a doctor's office or a clinic, what's the message that's on there? If this is an emergency, hang up and call 911. Society knows that if they call 911, depending on what the situation is, they're going to get a police officer, they're going to get the fire department, or they're going to get the ambulance. We don't stop. We are a 24-hour day, 7-day a week. And what we have found in this industry is people will call us for a wide variety of things, up to, yes, we have the traffic accidents and the shootings and the multi-fatality. But I will tell you, we also get the people that are lonely and they call 911 because they just want someone to talk to, or they heard that the meals are great at John Peter Smith or they need their medication refilled. And in this industry, after being in that type of environment, it does to a degree have ways that has this kind of wear and tear. And for example, any given shift, if I'm out there on the ambulance, I could have told a mother that her 1-month-old is dead. And that is a hard conversation to have. And because out here in Fort Worth, we're such a busy system, I clear that call. And then the next call may be that frequent 911 user who has their bags packed, ready to go to the hospital because they want to go charge their cell phone. Y'all, I'm not kidding with you that these are the type of situations and calls that our EMTs and paramedics are experiencing out there on the ambulance. And I think more of being in that, more of those type of situations, it does wear on you. It leads to burnout and compassion fatigue. And yes, the hard calls are hard, but those are kind of few and far between in relation to the overall calls that we're seeing out on the ambulance. So I think there is something about expectation versus reality. And I've heard a lot in our industry, people say, and I think we've gotten better as an industry, but people saying, well, this is what you signed up for. This is what I signed up for. And I really question that, especially over the last 2 years and a global pandemic and just all the things going on. And being in this industry for 20 years, many of us sit back and ask ourselves, like, is this really what I signed up for? Like, I know that there's this expectation versus reality, and there is a difference. And then once I got into this field and started gaining experience, yes, there was a difference. And I knew I would not be probably around some of the most pleasant people, but it does get to you after a while of the demands of someone calling after you've run maybe 10 or 15 calls in a shift, and a dead person here and a burnt person here and someone that wants their medication refills, and then someone who just yells at you and just curses at you and just maybe has a lower acuity complaint and says, take me to the hospital and stop talking to me. Like, those are hard situations. So that's why I think in our industry, we do take a step back, and we some of us have lost that why I got into this field, and really asking ourselves, is this really what I signed up for? And like Deborah was saying, especially over the last year, we at MedStar, we've been pretty blessed. Like, our turnover rate just globally as an EMS is pretty high. At MedStar, we've been pretty good about retention and recruiting here within our agency. But we also have seen quite a few folks retiring. Just last month, we had 5 employees retire all within 2 months, right? So we're seeing a lot of that in our industry. Now, going into that, I know that first responders, we are reluctant. And, so I know we're talking about stigma, and I think associated with stigma is this concept of expectation and reality. And did I really sign up to see and experience some of these things? But I also believe that we're reluctant to reach out for help. As Deborah was saying, we're the ones that are supposed to be strong, right? We put on armor every day when we get to work to do the jobs that we do. And here's what I've learned about first responders: we're great at putting the armor on to protect ourselves, but we suck at taking the armor off, right? And so that's where I think that there is this huge gap when it comes to when we're struggling, truly reaching out for help. And I think that goes into some of the things associated with stigma, especially for the first responders. And right now I'm talking about first responders, meaning police, fire, and EMS. I'm kind of specifically focusing on EMS. Billy may be able to kind of give you a little bit more detail as it relates to law enforcement. But in our industry, we don't want to reach out because we're afraid of how we're going to be viewed by our peers. right? Because we wear this armor, viewed by our communities, viewed by our family members, but viewed by our peers, right? Like there's a huge pride and ego thing in our industry. We're afraid that we're going to be judged. One of the biggest things is if I reach out or if I say I'm struggling, this career that I've worked so hard for, I'm going to get fired, or I'm going to get demoted, or I'm going to be taken off my apparatus, or the ambulance is one of those things. So there is this reluctancy to reach out thinking that there's going to be some sort of punishment associated with that. And I always like to tell people, like, think about, like, let's put the pride and the ego aside for a minute. You know, when you're physically hurt, like what Deborah was saying, you reach out, you go to a doctor, you get help. Imagine a world in which we sought the same help when we were emotionally struggling, right? Like think about how different our world would be. So these are just some of the things associated with stigma in the first responder world. Now, what's being done? A lot of things are being done to address mental health and wellness in our industry. We know that there's a lot more agencies that are doing training and providing education to their frontline folks and even to their families. We know that there's telehealth, there's hotlines, suicide hotlines, crisis hotlines. Many organizations are doing some form of peer support. There's employee assistance programs. There are now bills that are being created to address mental health compensation, a variety of counseling services, wellness programs, chaplain services. Let's get a dog in here for some emotional therapy, critical incident stress management, directories, apps, surveys, retreats. Like, I think that as a community, we have done an amazing job of addressing some of these things. But here's my biggest issue, and that this is kind of also my why of why I'm in this group is, okay, we know what the issues are. We know that there's stigma out there and gaps, and then there's all of these resources. So what's the problem? Like, why are the first responders still struggling? And I do think that there is also another component to this of truly being able to navigate our first responders to the most appropriate resources. So you can have somebody who's struggling, but do they know what resources are available? Do they know who to reach out to and how to reach out and how to navigate to some of these resources? And I would argue to say that many folks in this industry within our cities and societies, that's one of the gaps is the stuff is there, but people may not know how to access them. And Empower Fort Worth is really on this quest to put all of these amazing resources together and say, okay, our caregivers are struggling. Here's the resources, but here's how we get them to these resources. And so that is, my why for being here and from a first responder perspective. So thank you so much for having me. Stop sharing now. There we go.
Desiree, thank you very much. That was a wonderful presentation, and thank you for expressing why you were involved as well. I think it was interesting you mentioned the word compassion fatigue, and of course, I think that's what attorneys and others struggle with. When you are experiencing people at their worst every day, and really that's when they call lawyers, psychiatrists, EMS, the police and fire. Nobody calls them and say, hey, we're having a great day. They call us when they're having a bad day. And that's when we see people often at their worst. And when you're exposed continually to these negative things, like you said, traumatic events that you witness, that certainly has secondary traumatic impact on us. And to see someone struggle, to see something horrific happen during the day, and people would think we just kind of walk away and it's not a big deal and it's just another thing we do throughout the day. We take that home with us, and it affects our sleep. It affects our relationship with people. It affects who and what we are. And some of us disconnect from that, and that's our coping mechanism, and that's what's called compassion fatigue, where we come to the point where we disconnect from our emotions, and we come to the point of we don't care anymore. We just kind of go through our job and motions. And that's not good, because you mentioned we all got into this, both of you mentioned, we all get in this field to help people. And you're right, over time, we kind of lose the sight as to why we got in here. Sometimes we think, gee, is this really what I spent all this time in training for? And this is what I get. So I completely understand and agree with you there. You mentioned about loneliness. It's interesting. England appointed a loneliness minister, the ministry of loneliness, because people are lonely. It's interesting in this today of society where people have social media, we're connecting with each other in maybe ways you would think better than ever, yet we're more disconnected, we're more lonely, and that impacts our ability to be able to handle some of these stresses. Deborah, you mentioned mindfulness and things like that, and it's certainly true, because being aware of who and what we are, enjoying that present moment, I think we forget about it. In a day where we're continually bombarded with media and messages and reactions, it creates a low level stress, and that low level stress impacts our ability to view people, and that it gives a low level of fight or flight, to the extent that we view people who are not part of our family as enemy. If they're not part of our tribe, then they're an enemy. And that I see that in our country in a broad level. It impacts, again, all areas, from society to politics to the economy. Billy, we are glad you're here, and we would like to turn it over to you and hear what you have been doing at Fort Worth Police Department and your perceptions and what you see the future is going to be, and the challenges that you all face as well.
Okay, hello again. My name is Billy Mitchell. I just retired in July. I was the peer support coordinator for 13 years for the Fort Worth Police Department. During that same time, I was also a hostage negotiator. I started out in patrol in 91 and worked undercover in Vice. The reason I mention all of those positions is because I've had an opportunity to have a very relationship responsibility with the department. I've been able to see the department from different aspects. Being peer support coordinator means I work directly for administration. Now I can say this, with the Fort Worth Police Department at least, we have a very, very well-organized, robust department in which we recognize the importance of mental health. As a matter of fact, other agencies have come to our agency, me in particular, peer support coordinator, to get help with mental health issues, because their departments were lacking, or they were afraid that if they went for help, they would be ostracized. They would be relegated to desk duty. So what kind of problems are we having? What kind of problems have I seen? Of course, everybody knows about the stressors that first responders have to a certain extent. Desiree had a slide that showed what people think they do, as opposed to what they actually do, as opposed to what they believe they do. The bottom line is we have a varied responsibility. Joseph and I were talking earlier this week about mental health issues and officers dealing with mental health issues from the general public. And he said he had the perception that, well, us dealing with mental health issues with the general public was sort of relatively a new avenue for us. But no, actually, since I've been a police officer in 91, and I guarantee you, years before that, we've always dealt with mental health issues. It's just that now the state has mandated that we receive training in crisis response, so that we have better education, a better understanding of what a mental health issue looks like. Okay, before we dealt with them from a strictly behavioral standpoint, as in the law says this, and you need to do this, otherwise we'll put you in jail. And obviously, it depended upon the officer's experience and discretion on how he or she handled certain cases. However, since we've gone to crisis response training, we have definitely evolved some in our responses, and it's helped us to better serve the public. Now, as far as policing goes, I mentioned a little while ago that other departments have come to us because they're afraid of stigma. They're afraid of responses from their own department if they got help. Even within Fort Worth, and we've got a well-known peer support program. And I spent years just trying to help remove the stigma of getting help. There's still resistance because officers are afraid that if they seek help, then they'll be somehow punished or ostracized or relegated to desk duty. We have made great strides in trying to address that issue of just the stigma and trying to remove that so that officers feel unencumbered in getting help. We were fortunate to have some other agencies that are not directly involved with the city that officers can go to. But of course, we deal with the same stressors that everybody else does. Everybody who's watching this video deals with the same stressors that officers do to a certain extent. I mean, we all have family issues. We all have issues with getting to work, job issues. But also officers also have that added stress of dealing with critical incidents on a day-to-day basis. Everyone's seen somebody dead. Okay, that's everybody's seen that. But have you seen it 3 times this week? Have you had to speak with someone when they're saying the last things they ever said? I mean, I remember shortly after I got cut loose, which was right after my training, the 3rd night after my training, I heard a dying declaration from an individual, and I didn't know he was going to die. Ambulance picked him up, and we thought he was going to be okay, but apparently it was a dying declaration. And that has a permanent impact. I'll never forget that. 3 nights after I was cut loose in my training, I received that. And, that still impacts me to a small extent now. I've done well to deal with it, and I've taken advantage of some of the services that are available also. But the stigma attached with getting help for warriors. And we have to realize we are warriors. We consider ourselves warriors. One of the things that's hard for a warrior to do is admit that he may have a chink in his own armor, and admit that, things aren't okay. Of course, we're used to solving the world's problems. We're used to going from problem to problem to problem to problem to solve everybody else's problems. So it's hard to admit that, hey, look, I can solve your problems, but I can't solve my own. That's hard. And that's part of the stigma of receiving help. I can say this again. Our department, I still consider it my department. I'm still a member I'm the consultant for the peer support team. I'm still on that peer support team. Our department's done good things in order to try and eliminate that stigma. However, as an industry wide, as far as police departments all over the U.S., we're a rarity. Okay. And I can recognize that because I've had an opportunity. I'm also a trainer for the International Critical Incident Stress Foundation, which I train critical incident stress management. I train agencies all over the place. And it's a rarity. It's a rarity to have a department where we actually do take a lot of effort in striving to get the mental health needs of our department handled. So yeah, we definitely can benefit even our own department from any assistance concerning the availability of services to just removing stigma, making it easier for officers to access this information. Because if we're not doing well, then we're not going to do well with the public. At the end of the day, if our families aren't doing well, then we're carrying that stress with us to work every day. And that will affect the way we do our jobs. It just will. It doesn't matter what profession you have. If you're having family issues, it's going to definitely have an adverse effect on, or potential adverse effect on the relationships you have at work. And unfortunately, in our profession, we sometimes have to use deadly force. We sometimes have to use just necessary force. And when you're dealing with stress and on top of dealing with a highly stressful situation, highly volatile situation, situations where you've seen on videos and you don't want to see yourself be a victim, it does make a difference in the way that you interact with the public. And so, yeah, from that standpoint, it's important that we receive whatever, that we take advantage of whatever opportunities there are to assist us in our mental health efforts. Fortunately, like I said, there's this program called One Tribe that has been very, very beneficial in assisting us. I've had other therapists and psychologists like Dr. Atkinson that have assisted officers in these sort of situations. But again, it's really, really hard for officers to admit that they do need help. And it's hard for anybody, but especially a warrior who's used to dealing with everybody else's problems, having the guts to say, you know what, I'm not okay. I can help you, but maybe I'm not okay. And that's the real issue with law enforcement as a whole. Last year, right after the George Floyd incident, earlier in the year, we were celebrated as being heroes. And in a matter of a day or two, boom, all of a sudden, we are the worst thing on the face of the earth. And I can tell you this, I mean, I had enough time to retire last year, and I was on the verge of retiring just because I was tired of the vitriol hurled towards police officers. I knew that those officers involved in that situation, they weren't me. They weren't my friends that I work with. I've seen, I mean, in every profession, you can see something that you don't like in individuals. But the vast majority of officers, I mean, by far, they're noble individuals. They are doing the best job that they can. If you had insight and saw what officers actually did with their own money to help the general public, to buy kids belts, to buy kids shoes, to feed a family out of their own pocket, those stories don't get told. And I was on the verge of leaving last year instead of this year. But I prayed and I got confirmation I should stay another year. And that's the only reason. That is the only reason I stayed till July of this year. Because before June of last year, I was about gone. And that's from the stress of doing this job and just understanding that the general public, I mean, and unfortunately, most people do care. Most people do care. But unfortunately, a lot of times you hear the squeaky wheel. And there were a lot of squeaky wheels at that time. And and unfortunately, they weren't really getting the grease that they needed. I mean, in certain circumstances. And so the thing is, it's important that we do what we can to look out for the resilience of first responders, and the stories that Joseph has told me concerning lawyers. We had a combined law enforcement association of Texas attorney commit suicide in our police officers association building because of the stressors of his job. Look, I know that it's not just, I mean, of course, I spent 30 years as a Fort Worth police officer, and the last 13 years being the critical incident stress management coordinator, peer support coordinator. So I've gotten to see the intricacies of that. But I do understand that there's burnout. There's burnout not only in the police profession and lawyers and the EMTs and medical workers, but compassion fatigue, something that Desiree touched on earlier. That's something that really, I think more officers probably suffer from that than anything else. I think, I mean, looking in industry wide, that seems like one of the biggest things that we suffer from. I mean, of course, everybody's heard about post-traumatic stress disorder and other anxiety disorders, and those are huge, and the impact of those are incredible. But I think compassion fatigue, which is the fatigue that you get, the weariness you get from constantly helping other people in need and seeing their pain and vicarious trauma that's caused as a result of that. these are things that affect us all as far as within this community. And Empower Fort Worth is trying to help get these individuals, for one, to recognize the stressors, and also make it easier for us to receive the help we need in order for us to be more resilient, so that we can better serve the community, and we can be better for our families. Because at the end of the day, we've got to take care of our families. They're more important, at least to us, than anything else. And if we're doing a good job at work, and we're doing well for our families, then we're better people for society.
Thank you, Billy. That is a wonderful presentation. I appreciate you sharing authentically a lot of your thoughts and feelings about your experiences, what the department and other colleagues there are going through. What's interesting is, I think I kind of wonder sometimes if our community is suffering compassion fatigue too. Yes, we have one or two bad apples that do things in all of our professions, but you don't hear the other side. I hear almost not a week goes by where I hear one or two officers being ambushed, just sitting in the car by somebody. Other things that go on that are horrific for it. A lot of you are putting your lives on the line every day for us, and in very tough situations. As mentioned before, we see people at their worst when they're having a bad day. I kind of wonder too, sometimes the skills, I wish I knew early on a lot about mental health and these issues and struggles. I think I would have been better prepared to be able to respond and help people early on. And quite frankly, I think at this point in my life, I wonder if everybody should learn about mental health. It should be required courses in high school, because if 1/5 of America is suffering a mental health incident at any time in any one year, that impacts people around us immediately. And we need to know how to better prepare for it, how to better deal and manage it, not only within our family, but also in our community, our religious institutions, spiritual institutions, our workplace, our sports. So having said all that, I'm going to open this up to any other questions. We've got 8 minutes left. Deborah?
I'd like to really comment on something that I think is huge, and I'm glad you brought this up. I heard Desiree mention about how maltreated often they are as first responders by people. I heard Billy talk about how maligned the police department has been and how they're treated. You know, believe it or not, it does happen in healthcare with doctors and nurses too. This is an ongoing discussion that we have frequently. It's as if people believe they can treat us in any way they wish. They can say anything. They can be physically aggressive. One of the things that I do frequently is I do training for hospital staff about how to be able to be aware of the markers of violence directed against them and the different things they can do preemptively as far as, you know, the body space they need to take, knowing where the door is, being aware of what's happening in the situation, and all of those sorts of things. If you think about it, it's really sad that people who are there and who've committed their whole life to wanting to help others have to worry about being assaulted or harmed. And I think that's where a lot of the injury to them come psychologically. There isn't a feeling of psychological or physical safety in the workplace for all of us. And Joseph, your point is just outstanding about how maybe it's our whole community. I think you're onto something there. You know, when we talk about those of us who are helpers, when we've been injured in some way, it sends out a ripple effect to a number of other people. And so just within our families and our communities, but I think it also is a wider reflection of what's happening in our society. So I think this is a good way for us to move forward to be able to help the helpers, and maybe that will begin to help strengthen our community network even more.
And I just want to add, when we talk about how the community can assist, Billy may be able to add some additional details from a law enforcement perspective. Deborah, you may be able to add on some from a healthcare perspective. But I think it's just the communities empowering themselves of when it's appropriate to use healthcare services in relation to when it's appropriate to go to the emergency room, when it's appropriate maybe more to go to your doctor or an urgent care, when it's appropriate to call law enforcement out, when it's appropriate to call an ambulance, because we talked about burnout, compassion fatigue, and what I'm finding with our EMTs and paramedics, I think the environment that we're in and some of the hard things that we see are most definitely, can lead to a lot of mental health issues. But what I'm finding just over the years is some of these things in which we feel like and I'll just say it, we feel like we're being used and abused by the community. So if there is just a way for the community to really educate themselves on how to navigate through the healthcare systems, how to navigate the 911 system, I know that we try to put public service announcements out there, and the sense of entitlement, it's fascinating, right? That's what I think when I talk to EMTs and paramedics. They're like, I just want a nice patient today who is genuinely sick and needs my help. And don't get me wrong, like we like the other, patients when they're nice to us, but it's hard when we feel like we're being taken advantage of as being a safety net provider.
Thank you. Good point. Billy, last comments?
Well, yeah, obviously, people who are authority figures are often seen as antagonists in about every situation. Joseph, you talked about there's a winner and loser, and with court cases, and unfortunately, there are individuals that we have to actually get physical with. By the way, there is anytime you ever have to get physical with anybody, it never looks good. It never looks good. I don't care if the officer uses as much restraint as was humanly possible. It never looks good. One of the things I mentioned was I was a hostage negotiator for 13 years. Unfortunately, even if with all the skills in the world, you can't talk everybody out of a physical confrontation. You just can't. So one of the things that we deal with, is that perception that we're the bad guys, because anytime we use force, especially when you didn't see the first part of it, but you see the end of it, we're painted as villains. It looks bad. This looks bad. Believe it or not, we do a really good job of policing ourselves, at least in Fort Worth. That if we carry cameras, we scrutinize everything. Every call's scrutinized. We do a good job, but it always looks bad when you're using force. And so that's part of the perception that the public has of police in a lot of cases, is that we're overzealous in using force. And the majority of officers, we do, as I joke around and say, we do a pretty good job of screening out the sociopaths and the psychopaths during the interviews at the academy, and even during the academy and during training. We do a good job of that. But the thing is, it doesn't change the fact that sometimes there are questionable uses of force. And if there is a officer, and I'm just going to use Topeka, Kansas, that does something wrong, it's going to be on video and it's going to be played a million times everywhere. So it makes it look like there's more actually going on than there really is. And you have to realize that the majority of officers it's a noble profession. We sort of feel like we're paladins. We are those individuals that go out there and we try and do what's right. At least that's our perception of ourselves. And so just understand, it'd be great for the general public to understand that, hey, look, we are doing our best. And we talk about COVID, we talk about the stressors within the last year and a half. It's been hard on everyone in this country, everyone in the world, basically. It's been more stressful. But of course, a lot of things are taken out on first responders. A lot of things are taken out on doctors. A lot of things are taken out on those individuals who they can lash out at. And those are the individuals who are working in the community. So that's just to touch on something that Desiree was talking about. Yeah, it's important that we recognize that, and even we recognize it in ourselves.
Thank you, Billy. You hit some very important points there. One of which is a lot of the decisions you all have to make have to be on a split second, and they can have huge ramifications, not only for your career, but the life and death of other people. And that's an enormous stress to be carrying around, and pressure that you take throughout your day. Each of you are doing wonderful things. You represent communities that are doing wonderful things, saving lives, rescuing people, being there. Of course, in the news, we hear of the one out of a zillionth time something goes wrong. Unfortunately, the news and media doesn't say all of the wonderful things, the compassionate things, the dedication and work that you all do in terms of charity, in terms of helping people, and the smiles and the rescues you bring. Thank you very much for all that you do. I appreciate it very much. And we look forward to Empower Fort Worth transforming this city and all of our lives. Thank you.